All right, this is number 4 in part 4 of our core concepts in global health. And this is actually one of the most important of all the videos. Because what we're going to do, we've already introduced this young girl. For those who haven't seen the prior videos, this was a young Kenyan girl from the Kenyan-Tanzania border who was born with low birth rate, suffered from chronic malaria, chronic anemia, recurrent diarrhea, multiple pulmonary infections, a very weakened immune system, and eventually perished. And she is kind of the symbol of what we're trying to prevent. And so if we're trying to prevent what happened to her, then it behooves us to look very closely at children like this and see what we can learn and what is known about their history. What are the drivers that causes the incredible burden of disease that they carry, as well as the significant under 5 mortality that they show. So this girl is, of the 2.5 billion poor people on the planet, 1 out of every 3 people being poor on the planet, she represents the bottom billion, people who are basically living on less than $1 a day. And this can be a real medical emergency, and that's what we're going to look at now. And there's many ways to do this, but the next slide, of all the slides, of thousands of slides over my career that I've created for global health education, is actually the most important. It is the easiest and the most direct and clear way to describe what's going on with children like that, and also to describe what our response should be, and analogously what we did in Village Hope Corps in the Chogoria area and why we did it. So this is only a growth chart. It's very simple. There are some small written things on it which makes it look complicated, but it's just a growth chart. So what you have here is a growth chart of a very poor child, not from Africa, but from Guatemala. And again, this is a child that his family lives on less than $1 a day then. And so what you're going to see here is the classic growth chart. This child is going to be born at day 0, and we're going to follow, they're going to follow this child for 72 weeks, the first 72 weeks of this child's life. And as the child gets older, then the child is going to put on weight. And like any growth chart, there is a normal. So if this child was completely normal genetically for that group of people, his growth numbers should fall right along this line or close to the big dash line. But obviously he did not, he was not part of that normalcy. What's going on here is that his chart is actually this small dash with the dots on it. The dots represent certain diseases. So this is one child, and what's going to happen, this is done by a group of actually nutritionists that were looking at nutritional problems and immune system problems in the developing world. I got involved because I did a grand rounds for the University of California, San Francisco family practice residency in the early 90s. And what started that grand rounds was just the knowledge that 50% of malnourished children die of 7-day measles. So a huge mortality then from a disease that even pre-immunization days would take the rare child. But 50% of malnourished children would die of measles. So that really brought up the fact that these malnourished children then had very significant problems with their immune system. And at that time in the early 90s, the AIDS era was really still pretty young, and we were learning a lot about the immune system. And we will go into kind of what this chart shows. So this one child then is born, and you're going to see on this little dotted line, you're going to see these little circles which represent actual disease entities. So for this one child, the child is born, has conjunctivitis or an eye infection very quickly, then impetigo, a skin infection very early on, and then a diarrhea episode, upper respiratory tract infection, diarrhea, conjunctivitis again, URI, diarrhea, URI, finally a bronchopneumonia here, at around age 40 weeks. And as you can see by now, the child has significantly fallen off the normal of that growth chart. And again, measles here and with bronchopneumonia at 44 weeks of age, and then a serious episode of diarrhea and a huge change in his weight at this point, and then slowly comes slowly back up to even this abnormal curve with another URI and diarrheal illness. So in the first 72 weeks of this child's life, the child has been impacted by a lot of very significant diseases. Now, this is a child of $1 a day or less, so one of the poorest of the children in the world, but in some ways is not completely representative of the girl that you saw on the prior slide, because this child at least was taken by the nutritionist to the local clinic every time one of these diseases occurred. So this child did get treatment for those diseases, where the child in the prior slide was living in an area where there was no medical care. So any of these diseases could have killed the child if the child wasn't able to fight it off for themselves. But nonetheless, this still forms a really good, and one of the few really good graphic looks at what happens to these children. And it's much easier to understand looking at it graphically than a rather an epidemiological numbers approach, which is somewhat laborious and very confusing and also very boring to a lot of people. Where this is very obvious and very critical, and we'll go through it. So the obvious thing you see here is that this child has fallen significantly off the growth curve, and by 72 weeks of age, there's a huge difference between what is normal and what is this particular young boy from Guatemala. Now, if we had we had done a study on that child's immune system, the humoral immune system of that child, which is basically the antibody production that allows that child to fight off diseases, and also the white cell or the cellular immunity of that child, the white cell's disease fighting, if you wish, cells. If we would look at both of those in this child, we would see that they're markedly depleted. And what happens is, as these children then lose weight and fall off the growth chart, then their cellular immunity and their humoral immunity markedly falls off. And that is what is happening here. And if this child was in Africa, then what could very well happen here is that this child then could develop in the morning a feverish illness, was not responding well, not eating well. At lunch, that was worse. By dinner, the young boy almost unresponsive, probably febrile. And if he had no treatment whatsoever, very well could be dead by midnight from falciparum cerebral edema. Now, this is in Kenya. This Guatemalan boy in the highlands of Guatemala did not have malaria to contend with, but the young children in our area of Kenya and Africa, most of them do. And so in that case, what would happen is that the hospital, a physician seeing that young boy or girl, would write down that the cause of death was malaria. But as you can see, I think from this slide, that's not actually true. What really is going on here is that there have been all this series of diseases encompassed, and also, in a setting of poor hygiene, of inadequate nutrition, of lack of clean drinking water, lack of hand washing, which has resulted in multiple diarrhea episodes, multiple upper respiratory tract infections. And as this has gone on, this child has been severely impacted. So what we see here then is that if you come from a clinical background, and for 23 years I did ICU medicine and primary care internal medicine in Northern California, and also taught at the University of California, San Francisco family practice residency program, we would send a resident out, let's say to Guatemala, when this child was 24 weeks of age. The resident would arrive here, would be in the clinic, and would treat this child from, let's say, 24 weeks of age to 52 weeks of age, and would come back feeling that that he or she had done a good job, because each of these little diseases here were treated correctly and the child survived. But what he or she would not see is the longitudinal picture of this child who was basically falling off the growth chart and getting into trouble. And out here, in the case of Guatemala, would possibly die from a severe diarrheal disease, a severe pneumonia or pneumonitis, or in Africa, it could be diarrhea, it could be pneumonitis, it also could be cerebral falciparum malaria. So, if you come from an epidemiology background, you would first say, well, you can't make any decisions just on one child. But the importance of this particular growth chart is that there is another line on this growth chart, and this is the solid line. And the solid line is the average village weight of all the children in the village at this particular age. So the children, the other children in the village were not having their conjunctivitis, impetigo, or diarrhea at the same time, but a similar series of diseases was occurring in those children to result in basically the same growth chart. So that as those children got to 68, 72 weeks of age, they were markedly abnormal, which means they for weight, and which means that they were markedly malnourished and that their immune systems were markedly impaired. They might die here of pneumonitis, they might die here of diarrhea, but you see that the prelude leading up to this is what that the major cause of these diseases were. And so what this shows then is the importance of what's under the curve, and that would be the nutrition, the good hygiene, the drinking water quality. Is there soap available? Is there medical care available? So those are the things under the curve, and certainly that's what we want to do at Hope Corps from our public and global health perspective, is that we want to supply those. And you're going to see that we put in clean drinking water systems in 200 schools, as well as hand washing stations with soap, 20,000 bed nets into the community, et cetera, et cetera. So we've hit hard what's under the curve. But if you come from the public health standpoint and say, well, that's all we should be doing, then what you obviously see is that if all you're doing is working under the curve on those things, and then the child presents here at 40 weeks of age with bronchopneumonia, and that's a pneumococcal pneumonia, and that child then has either nobody to treat him or no appropriate antibiotic, and then that child dies of bronchopneumonia, then obviously you have not gotten the result that you want. So what we need to do, and what we're doing in Village Hope Corps, is that we're applying a very multi-dimensional, multifactorial approach to healthcare, where we do the clean water, we do the bed nets, we teach the mothers to put their children under bed nets, to wash their hands, to provide clean water for their children, to emphasize breastfeeding for at least the first 6 months of life, if not longer. So we're working under the curve, but we're also, with our nurses who work at as a nurse practitioner, we are basically treating the children as they need health care. So this is extremely important. And if you come from the clinical world, you can see that if all you do is come here at 24 weeks of age, treat these illnesses, then leave, you're really not getting what you want, which is sustainable health. You're getting health in the sense that you're treating disease here, but in the long term, really this child continues to get into trouble, and there's a good chance that eventually something is going to go seriously wrong, and whether you be in Guatemala or whether you're in Kenya, that child is going to die of those problems. Now, there's one other thing on this curve that's extremely important and makes this plot so important for global health and also for Hope Corps and what we're doing. And it's probably hard for you to see, but it happens at day 0. So what you see here is this child should have been born at this weight, but was actually low birth weight here. And if you look at the unbroken line, which is all the other births in this particular village, in this particular time period, they were all born at low birth weight, which means that the mothers were impacted. So what was going on with the mothers? Were they malnourished? Did they have chronic anemia for iron deficiency or from hookworm? If those mothers were in Kenya, did they have chronic malaria? Did they have HIV? Was there substance abuse? All the things that can create low birth weight or having mothers deliver children with low birth rate then is very important. So this chart not only talks about one child, it talks about all those poor child in the village, and it talks about all the mothers. This is the basis of child maternal health and why it's important. So if you look at our program and what we're doing and why we've won these awards, this really shows it, because we are going to take care of the mothers as well as these young children. We're going to supply the preventive strategies of clean drinking water and hand washing and bed nets and the education that goes along with it, as well as the curative services for those children and for the mothers, so that they deliver children that are not low birth rate, because healthy mothers usually have healthy children. So that is extremely important. Now, the other thing, if we go back to what we talked about before, when I first came to Kenya, there was 18 million people. When I was there this year, there were around 45 million people, and our horizon is mid-century, 2050, and at 2050 there is going to be 80 to 90 million people in the country of Kenya. So what you're looking at here, and if we only act on the diseases we see right in front of us, is we're looking at pure mortality reduction without fertility reduction. And so really, if all we were to do is what you see here, is that we are actually throwing kerosene onto the fire that's driving this huge population increase, particularly in the developing world. So what we need to do then is we need to address those mothers that this slide implies that are out there that are delivering these children that are low birth rate, and we have to give them the ability to control their own fertility. And at Hope Corps we do that by focusing a lot of time on education, on family planning needs, making family planning available, and also with our microenterprise bank. We know that as you raise women's economic status and educational status, they voluntarily reduce their fertility. So that women physicians, women in law, women professors in university now are having only about 0.7 children per woman. So they are voluntarily deciding to have smaller families. And obviously, what I've just said about Kenya, this is extremely important. So we're going to then move on in our next video and talk about the child survival technologies. What we can do then to improve this particular problem here with clean water, good health care, immunizations, focusing on breastfeeding, bed nets, and we're going to also, though, talk, which are all mortality reductions, but we're also going to talk about things like child spacing and fertility control and family planning for the mothers, so that we can do both things, that we can reduce mortality and we can reduce fertility at the same time. And if you look then back to this child, this is absolutely, what was on that particular growth chart is absolutely essential of us understanding who these children are and how they get into problems and why they get into problems, and therefore what we need to do to be sure that a child like this actually survives, and that their mothers survive, and that both the mother and child are healthy, and that the mother has a chance and the ability and the access to being able to control her own fertility. And that is the multidimensional, multifactorial approach of Hope Corps. And I argue heavily when I do my lectures in the United States that that is global health in the 21st century. In the 20th century, we would focus on one thing. We would focus on diarrhea. We'd focus on pneumonia. We'd focus on HIV. We'd focus on malaria. But we wouldn't to deliver a complete package. To do correct child and maternal health, you need to have all that was on that slide. You need to have the public health interventions, you need to have the curative services, and you need to have the family planning and the ability for women to control their own fertility. So we will come back and pick this up again and look at child survival technologies, but this then still remains one of the most important videos in this particular series.